At 11, test results released show some people who were exposed to a contaminated well in Portsmouth have higher levels of potentially harmful chemicals in their blood. The well was at the Pease International Trade Port. Good evening to you. I'm Shelley Walcott. The Pease Group had levels of the chemical higher than what's found in the overall U.S. population, but lower than groups of people who were exposed in other parts of the country. WMUR's Stephanie Woods is live in Portsmouth to explain. Steph.
Well, Shelley, the first 100 adults tested after drinking contaminated well water will soon get their test results, but anxious parents are going to have to wait months to get their kids' results. Now they're all wondering what steps they should take if they do find elevated PFC levels in their blood, but these chemicals are still a medical mystery.
It's frustration, but it's also anxiety, just that long period of time to wait and then to get your results back and they're not really black or white.
Andrea Amico's 4-year-old and 2-year-old kids attend daycare on the Pease International Trade Port, and her husband has worked there for the past 8 years. They drank water from the Hazen well until it was shut down last May after levels of perfluorochemical levels were found, 10 times higher than the amount the Federal Environmental Protection Agency considers acceptable. Amico then put pressure on state health officials to test people affected.
It was concerning to me personally that my family was exposed to this chemical, and I just wanted to know, what does that mean? What do we need to be concerned about? What do we need to watch for?
The State Department of Health and Human Services did test about 500 people affected and is now releasing PFC chemical levels from the first 98 blood test results. For one chemical, 8% had levels above average. For another, 19% were above, and for a third, 41% were above average.
There are no specific medical recommendations for how providers should screen and treat patients based on PFC levels.
Although the EPA lists PFCs as contaminants of emerging concern, the national data are inconclusive. DHHS held a meeting in Portsmouth Wednesday to report the findings. State epidemiologist Ben Chan says they've mailed out the individual results for the first 100 people tested. Kate Hayden also has a toddler in daycare at Pease. She says she's anxious waiting for his test results, but wants to know what they mean.
Because I don't know that these numbers will mean anything to us when we get them. But if my child develops cancer, a thyroid issue, all these other health effects that they're talking about that have the potential of developing, that the state would have a plan in place to be able to address those concerns and provide care for my child.
Well, anyone with questions about his or her test results can call the Northern New England Poison Center. They are setting up a helpline, and officials do believe that they will receive the final test results in this study in September. Live in Portsmouth, Stephanie Woods, WMUR News 9.